Our children are facing unprecedented challenges today, and these challenges can have devastating effects on their mental health.
The resources available to help our kids who struggle with mental health vary greatly from state to state, and many of the facilities meant to help our kids are also struggling.
Alicia Huck gives us an in-depth look at the state of kids' mental health in North Dakota.
There is a mental health crisis across the nation, and that includes our children's mental health. According to the CDC, suicide surpassed homicide as the second leading cause of death for teens ages 15 to 19 in the U.S. in 2017. The North Dakota Department of Health reports a total of 33 youth under the age of 19 died by suicide between 2019 and 2021. The ND Essence surveillance system estimates over 1,200 kids ages 5 to 18 attempted suicide in that same time frame. And according to the Youth Risk Behavior Survey, 36% of high school students in the state felt sad or hopeless nearly every day for almost 2 weeks, causing them to stop participating in some of their usual activities during the year before that survey. So what measures are being taken in North Dakota to combat this crisis, and could they be doing more?
Behavioral health must continue to be a top priority. We've got to keep expanding critical behavioral health services. We've got to be reaching those in need sooner, and we've got to reach them closer to home.
Child psychiatrist Dr. Damon is one of many mental health professionals in North Dakota who agrees wholeheartedly with Governor Burgum's statement from his 2022 State of the State address and is desperate to find a solution to better support our kids' mental health.
The kids are our future. Our state's in a unique spot. We've got a lot of extra funds that are available.
An increase in mental health challenges among kids is a trend that has not gone unnoticed by mental health professionals in North Dakota.
There seems to be a dramatic increase as far as the need for services. I mean, it's just over the last 5-7 years or so, it seems like we've just had, there's a lot more kids that are requiring inpatient stay.
But the state of North Dakota is struggling to provide access to therapists, psychiatrists, and social workers. And as Dr. Damon emphasizes, even a lack of facilities to treat our kids.
There's been a dramatic decrease as far as the overall placement opportunities that we have with the kids.
The state hospital, which closed its adolescent wing in 2012, is one of the facilities Dr. Damon is referencing. The state hospital was a safe place for youth who posed a danger to themselves or others and required stabilization. Now, kids have to wait in emergency rooms, sometimes for days, until they can be placed in one of 3 inpatient psychiatric hospitals in the state for youth. Once a child is stabilized but continues to require longer, more in-depth treatment, they're often referred to a residential treatment center where they receive psychiatric and psychological services, individual and family therapy. There are just 3 residential treatment centers in North Dakota, and just like every other treatment center in the state,
we're always full and we always have a wait list.
Brian Winterberg is the executive director at Pride Manchester House in Bismarck, the only residential treatment center in the state to serve kids under the age of 10. With only 2 other residential treatment centers in the state, Dakota Boys and Girls Ranch in Minot and Prairie St. John's in Fargo, a child can wait as long as 2 months to get in.
Once we have a child leave our facility, they have completed treatment successfully and are ready to go. The very same day, we have another one from our list come in.
As previously mentioned, Manchester House, Prairie St. John's, and Dakota Boys and Girls Ranch are the only 3 residential facilities in the state. They provide intensive inpatient treatment for youth with serious emotional and behavior problems. And the 3 facilities serve kids from across the state. But Winterberg says that placing kids far from home is not often ideal because successful treatment really needs to involve the family. And I'll explain later tonight that there are additional challenges facing youth who have no place to call home.